the hours, the diligence, the expertise. We ended up with an agreement that's fair, that's very, very fair to Ardent, and Ardent was very special in making this very fair to us and to Tulsa. And I want to thank Ardent for their cooperation, their help in this, the terms they provided that gave us a chance to do this, their full-fledged sincerity in trying to make it work for Tulsa, but beyond their own business objectives. And so they have become a true partner in this, and we're looking forward to working with them as we go forward and make this transition. Here, as you know, the hospital, returning to public hand, locally focused, produces the platform for the Oklahoma State University College of Osteopathic Medicine to have their residents trained and able to serve at the same time our indigent population, not just Tulsa, but for all of northeastern Oklahoma. The residents were absolutely a key part of this. Boy, I'll tell you folks, don't ever try to do anything politically if you don't have all the bright young people that are affected by it for you. They were wonderful. Additionally, this would not have been possible, nor would it be possible going forward, were it not for the George Kaiser Family Foundation, for St. John's in their that charitable effort in this regard, and others. But the George Kaiser Family Foundation has been absolutely magnificent.
And there are times as mayor when moments happen and you want to take a step back and think about what will this moment be in 10 years when people are looking back upon it. Because it's not been an easy journey. And those of you who have been on the road for a lot longer than I have, Mr. Speaker, know a lot of the pain that's been along the way. And many times when I think Hillcrest and OSU had really given up finding the best solution, but needed a solution. And in fact, as Bob said, what really happened is what happens in this community, and what we'll look back on, is that a broad group of people from different venues and different perspectives came together and said, we care about the next generation of healthcare. And it's important work that we've done today and that we've been doing in making sure that this continues.
I'm a Oklahoman resident for the last 27 months, and I think for 27 months I've been working on this project. It has been a labor of love. I clearly realize the risk that the medical school and the hospital and the citizens of Tulsa County, Northeast Oklahoma were experiencing if this hospital failed. Back in mid-November, I was honored to attend a meeting in the governor's office. In that meeting was our speaker, Chris Benge, Senator Coffey, our pro tem of the Senate, the governor, Scott Meacham, and others. President Burns Hargis was there, Ken Levitt from the Kaiser Foundation. And we talked about and negotiated and discussed what needed to happen in Tulsa with this hospital and this medical school for hours. First time I never had the honor and privilege of doing that with such esteemed leadership. And finally the governor said, we're not leaving until we have a deal. I don't know if I had any plans that night, but obviously they were immediately canceled. But as a new citizen of Oklahoma, I was very proud to be part of that group of people that was able to structure this deal. When we came back to Tulsa, our mayor took the ball and ran with it at full speed. I'm honored to be part of her team. We were meeting in the city hall and in her home with our city council throughout the holidays. We never missed a meeting. I think we did cancel Christmas Eve, if I'm not mistaken. But Bob Poe and others were there, and as citizens of this community, you can be very, very proud of your city council and your mayor. Immediately took action, got the trustees ratified within a week, if I'm not mistaken, and that may have been a first for the city of Tulsa in a long time. But clearly, every healthcare system in Tulsa, Oklahoma, has a vested interest in the success of this hospital. It doesn't matter if you work for or represent Hillcrest, St. John, St. Francis, Southcrest, or any of the other specialty hospitals. We all have a vested interest in the long-term success of this hospital and this medical school, which we are all very, very dependent on for the future development of our physicians and medical staff. So it's a privilege for me to be here today. Thank you very much.
This is an extraordinary time. The OSU Center for Health Sciences and the College of Osteopathic Medicine are proud to live on mission of providing quality physicians for those folks in Oklahoma. You'll find us in your communities where our students do many of the health care, some of the fairs. You'll find our network in rural Oklahoma and also here in Tulsa. It's also been my privilege to work with this asset that we're standing in today because it helps meet the medical needs of the community. And we are delighted to certainly be part of that. I'm proud of the long history that the College of Osteopathic Medicine has had with the teaching hospital in the production of the physicians. Since 1945, over 2,000 graduates have walked out of this facility and are either currently practicing or were practicing in the state of Oklahoma. That's an extraordinary feat, and I'm so delighted that everybody has come together to continue that. As been said, it is a watershed today as the legislature and the governor, OSU president and board of trustees, and the city of Tulsa and our healthcare partners have really decided to make this happen. I'd also like to recognize the faculty and staff members from the OSU Center for Health Sciences who have joined us today, and also to thank our physicians and members of the Oklahoma osteopathic community, particularly the Oklahoma Osteopathic Association, for all that they've done in this effort. Without that support and without those folks who care, and many of them who were trained in this facility, I don't believe we'd be here today.
No, this is great, and you know, I just have to first say that I'm honored to be a part of what I consider to be a team effort, no doubt. Locally, all the folks that have been mentioned, the trustees, the different healthcare systems, the Kaiser Foundation, they've all been mentioned. The OSU leadership. There have just been so many people who have been a part of this, and I'm just honored to be a part of that. And I'm also, I would have to also say that it's been a pleasure to be able to work with the other leaders at the Capitol that I worked with, the governor and the Senate Pro Tem, over these past few months in trying to finalize the deal. I also want to thank all the members of the legislature too, I should say, because they offered their wholehearted support in completing the deal. We had to do this. I mean, this is so necessary for first the Tulsa community. We know how needed our stable healthcare system is for our residents. We have to have a stable healthcare system to be able to grow our economy, and I believe that with this agreement that's going to allow us to do that. It's going to allow us to flourish as a community, and then also continue that statewide mission of training doctors that will serve out in the state of Oklahoma for many, many years to come. Those are great things, and those are things for all of us to be proud of. And so I'm just thankful that I was able to be a part of this. And again, I see it as a team effort, and I can't say enough for everyone that took part and made this happen. And so we're excited to see it take off, and look forward to many good years to come. So thank you all very much.